Hi everyone, I want to thank you for coming and watching another show of Life Goes On. This is a program brought to you by Elder Circle, which is a sub-grantee of CSEP, the Senior Community Service Employment Program, which helps those 55 and older to find service, training, and unsubsidized employment. Today with me I have Tim George from Meds One. Thank you, Tim, for coming.
Thanks for having me, Carrie.
Okay, just to give the viewers a little bit of a background about yourself, what is it that you do over at Meds One?
Well, I'm Director of EMS and Community Health Outreach. I'm a registered paramedic and also a registered community paramedic. My job basically is providing direct control over the agency's operations, and then also I work largely when I deal with patient issues in the field of community paramedicine. A good half of my job is working with vulnerable populations, people who have high-risk medical conditions, chronic medical cases, etc. Also, with that role of director of the operations at Meds One, I also do a lot of consulting. Primarily the consulting areas that we work on would be industrial risk management. And also we have a large connection with high adventure camps for youth camps. And so we work with credentialed camp programs that provide adventure programs into the Quetico as well as the Boundary Waters canoe area. And also with that, we have a connection with our training programs, education programs, do a lot of wilderness medicine, wilderness education, et cetera there. So that kind of is a broad landscape that I have, that I work with in that area.
Okay, you said that you're a community paramedic. You go out a lot. I know that for a fact, just working with you. Can you give me, I know everything's confidential, but can you give me maybe a breakdown of some of the things that you see the most out there that are really concerning?
As far as in the area of community paramedicine, most has to do with, most of the contacts rather have to do with patients that have chronic medical conditions, multiple medical problems, numerous medications that become non-compliant for one reason or another. Sometimes it has to do with just the understanding of the medications and how the medications conflict with one another. Sometimes it has to do with the lack of an ability of a person actually to seek medical care routinely for chronic medical problems. And so what my job is to make house calls. I go out and meet with the patients in their homes, meet with their family members, and work with those patients to better their lot. Make sure that they have an understanding of the medications, make sure that they have an understanding of the resources, similar to some things that your organization does at Elder Circle, which is reaching out. But I'm the referral source when it comes to this.
Okay. Today's topic that we're going to just be discussing about is actually with the coming cold weather, sub-zero temperatures, and along with hunting season. Hunting's really big. So I briefly mentioned earlier to you today that one of the reasons why I really wanted to discuss the hunting aspect is when my grandpa was 61, he fell from his tree stand and he was hunting alone. And his tree stand must have been, I think, 65 feet or higher up. I was pretty young, so I don't remember the whole thing, but I do remember seeing him at the hospital. He had a fractured pelvic bone, and he had also had some broken ribs. So for those, especially since this TV show is dedicated to those 55 and older, I want to gear our conversation going into that. What is some of the common accidents that you might see for that age group in hunting? Do you get very much of that in your calls?
We certainly do. In northeastern Minnesota, as far as numbers and statistics, I don't have that information, just experience. I started working in emergency services in 1978. So given the 37 years of contact that I have over this time period and the fact that I meet that 55 and older criteria myself with my age, I can tell you that meeting the people of my age and older is fairly common in the outdoors when it comes to deer hunting season and ice fishing, interestingly enough.
Yeah.
The primary issue that we look at, the primary problem, has to do with just general resiliency. The person's ability to go from their day-to-day activities to something that is essentially a very, very aerobic, along with some anaerobic activities that they're not conditioned for. And so we end up seeing people who can make it to their deer stand, but sometimes can't make it back from their deer stand just because of general conditioning. And then the other areas that we look at are people that develop cardiac disease through their life and then end up still going out to the deer stand without connecting with their primary care provider to determine if this is something that they're conditioned for, or not even conditioning between the time they are going out fishing, which probably is a fairly benign activity for most people, to the time that they actually have to carry a good deal of weight out into the woods, sometimes many miles. And so we see people in those situations that the conditioning is an issue. And then we also see people that have respiratory problems, typically long histories of asthma, and not having the conditioning to actually make it from the trailhead out to their stand and back. And then we see the falls like you're talking about with your grandfather, sometimes with a harness, sometimes without a harness, and both can be an issue. With harnesses being involved, we have situations where we have what we call in our business suspension trauma, which is hanging in the harness from a tree and not understanding that you have real limited time when you do that. If you actually are suspended from a harness from a tree, you probably have anywhere from 10 to 15 minutes before you can have circulatory problems in your body that would render you unconscious. Those people that don't have the harnesses naturally are going to be in the same situation where we have orthopedic injuries, possibly head trauma. All of that is probably the spectrum that we see when it comes to people that are out in the environment that, again, they're not prepared for.
Okay. Now, I was just thinking as you're talking about, some of the things that you see in going to your doctor and discussing with your doctor first. Northern Minnesota is very Scandinavian. Lots of stubborn people. Myself would be probably included in that stubbornness aspect. What would you say for advice to those people who really should be more careful?
Well, first of all, again, preparation, making sure that we talk to the primary care provider once we get a chance to see them. And that's another issue that we have, is the general access to the primary care provider is probably fairly limited. I think most people's experience to going into most clinics would be that they probably have about 10 minutes to actually talk about what they're in there for. Then they probably are only being looked at for probably one condition. But in that time period, it's nice to actually, on that exit interview, to say, hey, what do you suggest? Or is it possible that I could be, presented with problems if I decide to take upon this activity? And then also the other part of it, when we start looking at this, most people don't look at what they're doing as a high-risk activity. We probably spend a good deal of our time walking very short distances, lifting very small weights when we carry them those distances, and then we start looking at several miles of trekking, carrying a rifle and other gear with us, and then climbing up in a tree. And then there's that whole area of concern, too, when you're just sitting in that stand. Years ago, we used to do a lot of driving and deer driving, which was a very active process. And then we've moved into deer hunting, for instance, walking out, getting in a stand, and staying there for a period of time. And that itself can be involved in all sorts of medical issues, especially for somebody that is on many different types of medications, blocking agents, for instance, for blood pressure, issues related to blood clotting and those type of concerns. I know in the last couple of years that we have worked with patients that have had blood clots in their legs from just sitting in a deer stand in the cold. So all of that presents you with the concerns that you should bring to your doctor or primary care provider and say, I'm going and doing this. What activities do you think I should be limited in? And then make adjustments. If there's certainly different abling that we're looking at with an individual where they have limitations, there are laws that actually are set up within the state structure for gaming or taking game, where you can actually, adjust how you actually do provide the activity for yourself. One would be taking game from a vehicle, which can be done if you have a disability permit, a disability letter rather. So looking at the DNR regulations and that, and say, is it possible that I can still take part in these activities, but not at the risk level we're looking at?
What are some tips that you would have for somebody that's getting ready to go out, especially if they're watching this show and realizing, okay, so we need to go see a doctor because I know I have all these different issues and I really enjoy hunting and I don't want to miss out on hunting. I know my grandpa hunted until he was in his late 70s, early 80s. So it's something that somebody can enjoy, but doing it in the right way. What are some tips that you have, gear, any specific gear that you discuss?
Oh, sure. First of all, not gear, but just activity. Start walking every day. If you're not walking now, get active. We're talking 3 weeks probably from the time that we're filming this to the start of hunting season, or many more weeks, hopefully, to the time we are actually seeing people going ice fishing. Start walking, and start walking with a little bit of weight. If you have, as we're lucky in Grand Rapids, having the Y available there, start working out at a low level. Start becoming active. That's going to be the most important thing. Secondly, as far as preparedness, when you're going to go hunting, make sure people know where you're going. Start making those plans where you let people know beforehand, this is actually where I'm going, this is how late I'm going to be, these are my plans. And that's good for anybody. That's not just someone that has limited issues because of cardiac disease, hypertension, other types of medical problems, but any one of us. Make sure people know your plans, the timing, and then any other type of alternate plans you may have. Because you may have a situation where it's just not going to work where you're going, but you decide that you're going to take off and walk a certain area. If you are looking at communication with the outside, make sure that you know that you have cell phone access if the area that you're working, for hunting or fishing, whatever, has a tower available nearby. Make sure you know that the number of bars you have on your phone so that you can get out. If you're going to count on the phone for location from 911, understand that that's going to be really limited. 911 access and your provider access for your phone company is going to be very, very limited to locate you exactly at the spot that you're at. It can give you generally a pretty good range, and then again, that depends upon the type of connection you have. And then when you go, make sure you have a map, and then let other people have a map where, your loved ones, the people that you're leaving the information for, especially if you're going alone, print one off of Google Earth and give them a copy of it. This is where I'm going to be. And that way, as you know, you work in search and rescue in Itasca County, you want to be able to find someone fairly quickly. And the quicker you can find someone, if they have a medical problem or an injury like your grandfather, the chances of that person making it through are much, much, much better. As far as equipment goes, food.
That was my next question: is what's good food to bring with?
Well, Gorp, trail mix is a great food, but I always think about what is a person like. Something that's going to be some simple carbohydrates mixed with some complex carbohydrates. And think about the food that you might need in case you have to spend that unexpected night out. Matches. There's all sorts of matches out there, but matches that actually have a little bit extended burn time. I know these are green, and so this may not show up, but the stormproof matches are really great. And again, Gorp. Any type of medical problems that you may have, make sure that you have those things that can actually support you while you're out there. We're not going to be carrying an ambulance with us, probably
No.
a large trauma kit, but when people need to have their inhaler, make sure that you have an inhaler. I brought a new inhaler just to make sure people know that sometimes with these inhalers, they're taking one out that doesn't have enough of the medication in it.
Oh, yeah.
The counters are on the inhalers now, which is really great. And this one says that I have 64 puffs on this. And so you want to make sure that you can, bring that with you. And then a lot of times people don't look at fall and winter as being the type of exposure that you're going to potentially have to those things you could be allergic to. And I can tell you that we do have as many contacts in the fall, especially early hunting season, pretty much until the snow starts flying and settling quite regularly with bee stings, wasp stings, those type of things. So, carrying your EpiPen and have that available. But one of the most important things I think that people should take with them in case any situation happens out in the outdoors would be a whistle. And this is a very loud whistle. And whistles are great because they take very little energy to create a signal. Plus, the frequency of whistles are such that we can find them quite readily from a direction. that we're looking. It's not as if you're yelling, it's getting absorbed into the trees. You usually target on whistles. But again, you can be laying at the bottom of that tree with that fractured pelvis or those injuries. Whistling takes very, very little energy to create the amount of sound necessary for us to find you. And whistles are also those things that people don't generally hear. So if there's other hunters in the area and you start hearing whistle, it's one of those things that we look at as a concern, as a sign of some type of risk to somebody. Shooting a gun, well,
Everybody's shooting a gun.
Everyone's shooting a gun. So, that may be one of your last-ditch issues. But
unless you can do it in Morse code.
Yeah, or do it before you're supposed to be shooting in the morning,
or
after you're supposed to be shooting in the evening, because that could bring the authorities.
Very true.
Yeah.
Very true. A thought that I had is, what about bringing extra medication?
Yeah, we look at the most common medication that people should take with them, probably being the rescue medications I just talked about. But if you have a history where you're taking routinely therapeutic aspirin every day, it makes a lot of sense to take at least one more dose with you in case you have to spend that extra night out. And that can be very beneficial in a lot of things, including cold stress injuries and prevention of that. There's a lot of good data now that when you take an aspirin, it prevents things like some frostbite. And so having that with you can be one of those double positive things. One is preventing some clotting related to the underlying medical condition you have, but it also could prevent some certain injuries.
Okay, my last question really towards the hunting part is taking a nap. Okay, I'm one that I have a tendency to fall asleep in my stand, and then I wake up and then there's like a really nice doe sitting in front of me kind of thing. But if someone has a medical issue and they have that tendency to either fall asleep and maybe it's a new medical issue, is there going to be an issue? I mean, can people like go into kind of a temporary coma kind of a thing with that kind of a situation?
I've never heard of that before. I do know that one of the greatest rests that I get is going out and sitting in my stand. And I think it's just generally part of the culture of hunting is we have a tendency to do that, and it probably is one of the more beneficial things that hunting brings us is that chance to relax. But that as an aside, wearing harnesses when you're in the stand, making sure that you're not going to fall out of the stand, and then making sure that you're insulated. Other than that, I don't know too many people, and you may be an exception. I know I'm not, but that will sit there for hours and hours sleeping. Short time of napping, etc., that's not going to be an issue. Certainly if you stayed there in that stasis for hours, any of us could develop blood clots and those type of things, but I don't believe it's one of those things that have been presented. We could create an internet myth out of this, though, if you'd like.
Oh, that would be fun. Maybe
Yeah.
we should get Mythbusters on the show.
Yeah.
That'd be great.
Yeah.
So,
Well, other than that, no, I think that as long as you're well insulated, have your nutrition level up, taking the medications, if you take medications routinely, and you stir quite regularly, you're not going to have a problem. But again, the biggest risk there would be not wearing a harness, not wearing some type of restraint to keep you from falling out.
really good advice. For those of you that are just joining our show, this is Life Goes On, a show dedicated to those 55 and older. Today I have with me Tim George from Meds One, and we are talking about hunting safety, and next we'll move on into the cold weather safety, because that is also right around the corner along with our Sub-Zero, and as you mentioned, ice fishing, which is, I've seen people come up here from south and they're like, there's cities on those lakes. You drive by a lake and there's a town out there, and you actually drive out there?
Yeah. And when you look at ice fishing and look at all those cities and the people driving very large, heavy vehicles, we have a tendency to think that the ice is safe. And we want to keep always our head above water. And that's going to be an important part of the cold weather issue is making sure that you stay above the water if you're walking on a lake. And the way ice thickness varies on a surface of the lake is significant to this conversation, because you can drive in one spot and the next area you could have a spring or candled ice where there's a lot of air that has been trapped in the ice, producing bubbles that the water freezes around, and it doesn't take much, as well as pressure ridges. Not only can be a problem when you're driving and you hit one, but near pressure ridges you can have areas where they have thinning You can have water coming through the surface that actually will melt. And lately, the last few years, interestingly enough, looking at the weather, and probably the last 3 years, we've had a lot of variability in ice thickness. So falling through the ice is a huge concern. Whether you're out cross-country skiing, whether you're just out for a walk or out ice fishing, one of the things that we suggest is carrying a set of ice picks. They're very inexpensive and wear around your neck. You can put them in such a way that you're not going to stab yourself with them because they seat together. And if you fall through the ice, you can actually put them in and allow yourself to pick yourself up and over to pull yourself out. Make sure that if you do go out on the ice routinely, I wear a life jacket. I wear underneath, and it helps as far as the insulation factor, as far as layering. I wear a skiing life jacket underneath my parka. And so I can loosen my parka up, I still have the life jacket on, and that gives you extra buoyancy. That's not something that we're always suggesting, but it's just another...
That's a really good idea, though.
Yeah.
I've never heard of that one, so that's a good one to keep in
Especially
mind.
when you're skiing. I mean, if you're out skiing and take your shell off and you still have a little bit of, that torso warmth retention that you have with those. But the falling through the ice, that's the huge issue. And that's going to create all sorts of risk to an individual that has no cardiovascular problems, no heart disease. To the person that has it, it's going to just make things more complex for that individual. Again, and resiliency is what we want. We want someone that's going to be able to make it through a given situation, whether it's falling out of the tree, getting lost in the woods, or falling through the ice. And again, it's simple, keeping your head above water.
So moving the topic a little bit from ice fishing to more everyday situation, because our temperatures here get 30 plus below. So for our aging population especially, do you see a lot of issues in the winter, more hypothermia, people slipping and falling, those kinds of things?
The interesting thing, you talked about how stubborn we are, whether it's having to do with having some Scandinavian background, and I think just living in northern Minnesota creates that certain stubborn streak in you. Hypothermia, unless it's immersion hypothermia or someone that gets caught out in the outdoors unprepared, certainly if there's intoxication involved, those are the times we see hypothermia. Other than that, we're pretty much in control of that no matter who we are. We rarely, if ever, unless there's a fall outdoors and someone's not around to help the individual who's older, that person certainly is going to present with hypothermia. Most of the time we don't see it. And it probably, again, is because physically we have the ability to adapt to extremes of altitude and higher temperatures. Our body does adapt over time. But we don't have the ability to adapt to lower temperatures, and certainly not being underwater. So if you think about the lower temperature adaptation, it's our life. We decide to dress differently, we decide to act differently, and we know our tolerances. So we're only going to generally put ourselves in a position, again, as long as we're cognizant of the environment and our own limitations, we're going to put ourselves in those areas and those environments that we know we can tolerate. So hypothermia, certainly from an accidental standpoint or immersion standpoint, can be an issue. Probably not as much when we're just going out for those activities, as long as we're prepared for them. And certainly that preparation means, again, we want to be conditioned. We want to have that nutrition base available and the supplement for that nutrition as we're out there. Again, trail mix, energy bars, those type of things that can help bring up our carbohydrate levels so we have the ability to create heat. And then staying dry. And staying dry is a huge deal when it comes to prevention of heat loss. That's probably the key to it. And that's not just not falling in the water, but making sure that you have the ability to open up layers of clothing and get rid of the moisture, as well as protecting ourselves from all those other avenues of heat loss that we have, convection, the wind blowing over us, conduction of not sitting down on a surface that we're going to have the heat being drained away.
Like a rock.
Like a rock, without having some kind of insulation. Then, I talked about the evaporation issue, making sure that we're getting rid of the moisture off our bodies so that we're not, walking around in wet clothing.
Do you have a preference that maybe somebody who is just starting to get into some of these outdoor sports in the winter, and doesn't know exactly what to wear. Do you have any preference or advice on what brands of clothing might work better, especially for the underlayers? Because that underlayer is really important, especially, I know that much. So, do you have any preference for that?
We look at the essentially three areas of layering. The underlayers, whether it's anything from older fabrics like silk to the polypropylene to some of the other higher tech type of wicking layers that we have on our surface of our body. The underwear, Under Armour brand is one that's out there, but there's other similar ones to that, many other similar ones. Making sure it's not cotton.
Not cotton.
We always say cotton kills because cotton holds on to water, it evaporates slowly, and generally speaking, if you think about moisture in cotton, it's pretty uncomfortable. So you have the first wicking layer. The next layer that we look at is the insulation layer, whether it's a polar fleece type of material, various other types of layers that you can wear. And then on the outside we have the shell, and the shell is essentially a wind shell. Prevents some of the convection loss that we look at and also creates more of a comfort. And you can add layering in between there too. The important thing is, number one, layering, and then what you're comfortable with, and then staying away from the layering that that can actually cause problems. And again, cotton can be a concern. Now, there are some newer higher tech cotton blends. And again, the cotton industry probably be very upset. If anyone watching from the cotton industry, I apologize. But again, that can be an issue. Going way back, we're looking at the idea of wearing, worsted wool to a wool or down, and then again an outside of a canvas, treated canvas. And that was a very, very common thing for many decades prior to all of the presentation of the new high-tech materials that we have available. But that's first of all. And then not having something that you're wearing that's very heavy, because the more weight that you add, the increase in resiliency concern that you have with an individual, the conditioning of the person is going to have to be that much higher. And then adding on to that, footwear. Footwear should be the same. You have a wicking layer, an insulation layer, and then the barrier layers. I'm a proponent of using mucklucks. I wear mucklucks in the wintertime. And again, as long as they have a decent tread on them, they last for most, all season, from the earliest snow to spring. They work well. But again, there's all sorts of other different types of brands. One thing that I think a lot of people have a tendency to do is they'll throw on their cotton socks and then put on a pair of pack boots, and they become very uncomfortable.
Very uncomfortable.
Very uncomfortable. So with that, on top of taking some things with you, especially on ice fishing, a pair of dry socks, a
Wool.
Ziploc bag, yeah.
Wool socks are good.
And then switch out the socks if your feet get wet, and a little bit of resistance there. And then I'll go back to what my mom and grandmother used to do, is they used to always send me out with bread bags, because in case you ever do get your feet wet and the insulation layer of your boots, you can always put those socks on and then the bread bags over them, and it creates a little bit more of a barrier. And you might make it back to the truck or the car at the landing a little bit more comfortable.
I think I've done that once hunting.
Yep.
Maybe it was Ziploc bags, not bread bags, so.
Yeah.
But yeah, same thing. So I had another question going back a little bit into our conversation about some of the more common things you might see in the elderly, especially for the cold weather seasons. What about pneumonia?
Well, pneumonia is a disease of, we say, congregation. We come together, other people have, typically what happens is we end up getting some type of upper respiratory viral problem, concern upper respiratory infection, and then that could lead to some type of, bronchitis, and along with, say, underlying lung disease, we could end up getting some significant limitation in our activity capability. Certainly, even upper respiratory infection on a young person, healthy individual, certainly limits their ability to perform athletic activities and just go through their day-to-day activities without some limitation in breathing and heart rate increase, et cetera. But when we get together in the wintertime with various types of heating systems and HVAC systems in a building, limitation in an air movement, and we're close in. It doesn't take much to have one person spread something to another individual, and then on top of that, we could have bacterial infections that could take a hold. So with that, I always look at the idea of, again, being healthy, staying active, getting out. If you have upper respiratory problems or respiratory disease at all, making sure that you're taking your medications as you're being directed to. And if you have any type of situation that shows that you're having some kind of limitation because of some type of infection that seems to be setting in, see your primary care provider early, not later. And then, if you are also in a situation like that, probably not a great idea to be in with a lot of people all the time that are coughing and hacking and stuff, because we know it seems to just go like a domino right down the line when it comes to some of the assisted living facilities that we see, some of the congregate care environments, but as well as just places where people come together, like at town halls, etc.
Okay. Any last comments for me or anything on the top of your head you'd like to throw out there?
Well, again, our subject here is looking at people 55 and older, but just overall, again, the idea of preparing, making sure that no matter who you are, that you're prepared to take upon the activities that you are going to engage in, to go out there and be happy and hunt and fish or ski or whatever. It's all about a positive experience. It's not all about struggle. It's not about a negative experience. So preparing, number one. And then along with that preparation, make sure that you're communicating with people when you are going out and venturing away, and taking things with you that it would be necessary to support yourself in case you have to spend that extra night out. We talked about the apparel. We talked about making sure that you're conditioned, and again, as a final issue, making sure that you're communicating if you have any underlying medical conditions with your primary care provider, and that person can guide you clearly in the right direction to understand some things that you might be able to do to make sure that you can have a much better, much more positive experience.
And I just had a thought. For those that are maybe getting ready for the season cold, maybe carry a list of the possible medications that you're on with you, and maybe some of the actual illnesses you might know you have when you're with you, so that way if something does happen and paramedics are coming out, if you're alone and even if you're unconscious, are barely able to communicate that there'd be something on you.
Certainly. In Itasca County, we have what we call triad cards, and refrigerator cards. They're typically a bright reddish color, pinkish reddish color, and that has all that information. But also with that, there's a smaller card that people can carry with them. Now, anyone can do that. Again, the drug medications rather that they're on, the dosing, contact information, that's going to be very, very important. Allergies to medications. And then a full description of who you are, dates of birth, etc. That not only helps emergency services providers, especially the area about medications and allergies when we show up, but when we get somebody to a facility, they may not be from that area, and it helps in getting a person brought into the system. Electronic medical records are really reliant on having a person show up and knowing at least who they are and their date of birth to get them sent into the system. Not that it's going to delay care, but the care can be much more efficient, and then they can find out a lot more information once they can connect into their electronic medical record system, electronic health record systems that are related to that clinic or that health home that person has.
Okay. Any last things you want to spit out while we're here?
Oh, I could probably talk all day. So.
Yes, I'm sure you could.
Yeah.
Okay, well, thank you for coming. For those of you who are watching today's show, I just want to thank you for watching Life Goes On. Please remember, go out there, have fun as we prepare for the new season and hunting season, but also make sure that you're not letting your stubbornness get in the way. As we talked, that can be quite an issue, especially for those of you who are older and you're working or trying to find a job. Being hung up in a cast is not going to be able to help you in any way. So thank you again. Thanks for coming.
Hey, thanks for having me.